Hello everybody, my name is Dr. Amir Al-Khayr and today I'm going to talk to you about Plab 2 test. Before I started preparing for this test, I had millions of questions about it and I had no one to answer me. I didn't know how to prepare, what to do, what is this test itself, what is it, what am I going to be asked about, is it only clinical? Is there anything paper-based or computer-based? It was really hard for me. Therefore, I decided to make this video to talk to you about the test itself, to give you a general perspective, general overview of the Plab 2 test. In the next upcoming videos, I will be talking to you a bit more about my own personal experience, and I will be telling you how to prepare, what mistakes I have made, and how to avoid what I did wrong. I want you guys to pay attention now. The Plab 2 test. It is 18 stations. What do I mean by stations? Each station is basically a room. You will go inside, you will find someone who is the consultant. This person will be marking you. They will be giving you mark based on what you say. The other person would be an actor or an actress pretending to be someone else. For example, an actor pretending to be a patient, an actress pretending to be a mother of the patient, an actor pretending to be the brother or the father or grandson of the patient. You understand the perspective. There are 18 stations. Each station, there will be a paper hanged outside of the station. This paper would be the scenario, the setting, where are you at? Are you in the ER? Are you in A&E? Are you in the GP? Where you are. The rest would be a little bit like a small preview about this, what to expect inside, and then the question. The paper, you will have almost a minute and a half to read it, to prepare and to go inside. The station itself is 8 minutes. You have to take history, examination, and then management. Among these 18 stations, there are 2 stations that are only rest, whereby you would have 8 minutes for yourself, to have a sip of water, to eat something. They will have some kind of candy or sweet or biscuits for you guys. And the 16, the rest, are the Plab 2. Now, the main question is, these 16 stations, what are they? What can I expect? The thing is, you have stations that are examinations, procedures, teaching, simon, prescription, and everything else. This everything else is quite a lot, and we will leave it for last. Let's start with the examination. The examination. They will have the question outside is go inside and do the relevant examination and discuss management. You enter the station, you'll have to talk to the patient, you'll have to get proper history, and then you'll have to start doing the examination. Examination itself, it might be breast examination, testicular examination, abdominal examination. There are a lot of examination you have to be prepared for. After you finish, you have to talk about what you found, and you have to talk about how would you manage it. Be careful, because most of the time there will be a mannequin inside, but in some cases, the patient, you have to examine the patient, the real patient. Mostly there will be a mannequin whereby you will be able to do your examination. And you will find findings, whether it was normal or abnormal, you will find something in the examination. The mannequin is so amazing, nice. I don't know how to describe it. For a moment you stand and you feel like this mannequin is a real person. Now, the examination is covered. We will talk about it more in the upcoming videos. Now the procedures. The procedure as well, mannequin, patient, consultant. But what do you do here? Either ABG, either venipuncture, either urine catheter. There are a lot of procedures where you have to do. Personally, I believe this is the hardest because you have to do something within 8 minutes. It's kind of tricky. Now, moving on to the teaching. The nice thing about teaching, there are no rules to follow. There are no strict things to do. Because in the teaching, mostly you are talking to a patient's relative, or you are talking to a med student, or you are talking to a nurse, and they want you to teach them something. Here, I want you to open your mind as much as you can and let your own personality and your own touch show, all right? Because they want to see how good you can simplify an information or something and explain it to the people in front of you. This teaching can be either an ECG, chest X-ray, it can be how to perform an examination, it can be a lot of things. Personally, and many people think that teaching is the easiest. Moving on to the prescription station. To be honest, I believe every doctor who is practicing medicine outside of the UK and graduated outside of the UK is going to find this particular station to be possibly problematic. Let me tell you why. I'm a doctor who I was practicing medicine outside of the UK, and I was unfamiliar with the form. Because in this station, once you go inside, you will not find a patient. You will only find the consultant and papers. This is a paper-based station. You have to fill it out. There is a paper form. You have to put the patient's name, patient's information, medication that they have asked you to prescribe for this patient. We're not familiar with this. We don't know how to fill it out. We've never done this. We've never seen this prescription before. That's why in this station I signed up with an academy to teach me how to make it, how to pass this station. It did not go so well. I will tell you more about it in my upcoming videos. The Simmons station. Now, this particular station is my favorite. Let me tell you why. This is a station where you have to act fast. In this station, you will enter the room. You will not find a patient. You will find a man-like or a woman-like mannequin. This mannequin is so close to being a real human being that it is freaky, to be honest. In my exam, my mannequin had an emergency. These stations are mostly emergencies, where you are in the acute A&E, and the patient has presented with something very, very severe that you have to act fast and you have to act quick based on ABCDE protocol. The funny part is that you go inside and you find this human-like mannequin and you talk to them and the mannequin talks back. And if you put this stethoscope on the mannequin's chest, you will be able to hear. If the mannequin has pneumonia, trust me, you will hear it. If you want to examine the heart, you will hear it. If you put your hand right here to check for the pulse, you will feel it. The mannequin would blink, it would talk, it can move its head. For me, when I was doing this, even though it's like you have to act very quick, you only have 8 minutes to do everything. I remember clearly that when I was talking to the mannequin and the mannequin moved its head to talk to me, I froze, like, oh, this is so nice. This station can be easily passed if you are just confident and if you follow a protocol. That's it. Now, the everything else, remember what I said? Alright, let's talk about this. Everything else can be many things, okay? It can be medical error, whereby you as a doctor or your colleague has made a mistake and you need, let's say, to manage this mistake. You need to talk to the patient, you need to find a way to solve it out, many things. So, we have, okay, so like I mentioned, we have the medical error. Okay, my handwriting is a bit ugly, please forgive me. Like I said, this station is where you have to admit that you made a mistake, you have to talk to someone, you have to say, I'm sorry, and how can we fix this mistake? Alright? The next one can be problem calling. Problem calling is, they will be not like the actor or the actress, they are pretending to be your colleagues. And this colleague has been, for example, late to work 3 times, or this colleague has presented to work with the smell of alcohol. So you have to go, you have to talk to the patient, to the colleague, and you have to teach them or like show empathy, like you're there for them, but at the same time you care a lot about the patient's safety. These two stations, they're very flexible, let's say, because as a teaching station, they don't have strict rules you have to follow. You can be who you are, you can be as kind as you want, as professional as you want, but at the end of the day, you have to make it clear that patient safety is your priority. Other things, they can be medical station, whereby the patient presents with complaint, and you have to take full history, do relevant examination. By relevant examination here, if there is no mannequin and the question does not scream examination, you can just verbalize that right now I would like to do a chest x-ray, I would like to examine your abdomen, blah, 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 blah. Then you will be able to pick up the diagnosis and manage it accordingly. Other than that, there is something called counseling. This is very common, and personally I find it easy because counseling, let me write them down. So you have the medical stations and you have the counseling. As I said, forgive my handwriting. The counseling, the patient presents with a lot of questions. Trust me, the patient will have a lot of concerns that you need to manage. In Plab 2, most likely you are an FY1, FY2, you're not going to be a specialist. The patient is not going to ask you for details about surgery, what will happen inside. Mostly they will have concerns like, how can I manage after the surgery? What would happen if this happened? General questions that you might find, that you might be asked every day. It's very flexible, just have to answer all their questions, and you have to be as confident as you can. And please, in counseling, something very important. If you don't know something, don't give a random answer. You can simply say, I will check with my seniors and I will get back to you. Other than these two, you can also find ethics. Ethics is, for example, let me think of something. Problem on the ward. A patient and his family are acting in a way that is bothering other patients. You have to go and you have to sort it out. Which reminds me of the other one, which is patient refusal. In this station, your patient is refusing medication. They don't want to be treated. They've had enough. They want to be discharged. You have to go inside, you have to talk to them, you have to explain the situation, the severity of this situation, and how important it is for them to stay in the hospital and to help us help them. The thing I need to tell you guys, patient refusal, many candidates think that they have to convince the patient. They will keep arguing until the patient says, okay, I will take the meds, or okay, I will stay. If the patient insists that they do not want it, it's their right. At some point, you have to realize that enough is enough. You've done your part. Now, what can we do when the patient refuses? We have to, let's say, shine a light on the dangers of their refusal and when they need to come back to us immediately, when we can help them. And this is when you have to accept that the patient has no interest in any kind of medical help. Other than the patient refusal, you have something called BBN. Oh, okay. Which is breaking bad news. This is something like you have the result of a test, something like that. And the result of the test, you will have to tell the patient that they either have cancer, HIV, anything that is problematic, bad news, and you have to be as kind as you can. Extremely kind. I'm talking this level of being kind, because this is you're telling a patient that they have cancer. You can't just go, I'm sorry, you have cancer. It doesn't go like this. You have to do it on steps. And I will tell you how I do it, and my personal way in my upcoming videos. I believe this is all. If I forgot anything, I will make sure to make another video about it, to remind you about it. However, these medical stations, these can be anything. I do mean anything. The patient might be complaining of tiredness. The patient might be complaining of shortness of breath. The medical complaint, in medicine we divide it. So it can be cardiology, can be respiratory system, can be GI, can be general surgery, can be nephrology, it can be neurology, it can be gynae, it can be pediatric, obstetric, anything. So don't keep your mind wrapped around something and say, oh, this is more important than that. This is wrong. In my test, in Plab test for me, someone gave me the advice that counseling is much more important than medical. They said, don't concentrate a lot on medical, concentrate more on counseling. To be honest, I had 5 or 6 medical stations, which is a lot, 6 stations. Medical is the easiest and yet the hardest, because if you don't know how to manage it, or if you got the diagnosis wrong, you will be very nervous inside and you might ruin it. So be careful. I want to say something regarding this medical error, problem colleague, counseling, ethics, patient refusal, BBN. Don't listen to anyone who tells you need to follow a structure or strict sentences. You have to be natural. You have to think like you have to act as if you were in a real clinic. You're a doctor. If you're talking to a patient, would you remember what other people have taught you or have forced you to remember as sentences, or would you just speak your heart? As I mentioned, the exam is, sorry for that. The exam is 18 stations, 16 for Plab 2. To pass, you need to pass about 10 stations. The thing is, this number is not like set for all the people, because sometimes a station might get disqualified or excluded. A lot of candidates did not pass this, so they excluded. And each test has a passing mark. Some can have a mark of 120, some 110, some I don't remember. For me, I passed 13 stations out of 10. And I don't really remember my mark, but the stations I failed are prescription, I know, teaching, very hard, and examination. You want to know why I failed. The teaching, to be honest, I did a mistake, which is I followed someone else's structure. As I said, I was in an academy, I signed up for an academy. It was in Crew back then. And they taught me that in teaching, if the patient presented an ECG and if the colleague or the nurse presented an ECG and they did not get the patient's approval, you have to decline to teach them, because they need to ask the patient, is it all right if I use your ECG to learn or something like that? And I did as they told me, and it was wrong, and I actually failed one of the easiest stations ever. Prescription, I don't know why. I will show you now on the screen that I did this prescription station twice in their mock test, in the academy mock test, and I passed it both times, but in the exam I failed it. And in the examination, because it was the examination of a prostate and we did not have a mannequin for prostate back in the academy back then. So this is my let's say, special or personal experience with Plab 2. I hope you liked this video and I hope that I helped you guys. If you liked it, please don't forget to subscribe to my YouTube channel, hit the ring bell so you'll be notified every time I'll be posting a video about Plab 2, because trust me, there's going to be a lot. And guys, stay safe.